Okay, so I'm now moving on. So we are now coming to the session on modeling and tracing. I'm very honored to have two distinguished speakers. And so it's going to be two talks, 15 minutes, and then a 10 minutes discussion section. And I want to remind everybody to please use these questionnaire forms. So there's a link on YouTube that you can click, and then you can enter your questions. We're collecting them. And we'll then be discussing those with the speakers. So it's an honor for me to introduce the next speaker, who does not need an introduction. Actually, it's Bernhard Schölkopf, director of Max Planck Institute for Intelligent Systems, and also, of course, head of ELLIS, chairman of ELLIS. And he's going to talk about COVID-19 machine learning project at Max Planck Institute. So Bernhard, the stage is yours.
Thank you very much. Can you see the slides?
Yes, perfect.
Okay, so I am an example of what before has been called a member of the coalition of the willing, someone from machine learning, trying to make a contribution here. And I have to say, maybe at the beginning, I think one of the positive things about this current crisis is that we're seeing quite an open culture of sharing. So it feels it's not so much about priority and publications and patents, but more about progress as a community, because probably in the end, we all have skin in this game. And my talk tries to fit with this open culture, and it will also include an overview of projects that are very much work in progress. And hopefully that will inspire others to point us to better data or develop better solutions altogether to these problems. And two of those projects will include more progress, and for those I'll hand over to other speakers. So we'll have more than two speakers in this session, to other speakers to give more details, but many more people are involved overall in this set of projects, and I'd like to thank my whole lab, in fact. So I want to start with the topic of causality, which is an area that we've been very much moving into over the last 10 years or so. So the idea is that every statistical structure has an underlying causal structure, which generates statistical dependencies, but which not only is useful for prediction, but also for estimating the effect of interventions. And we're trying to apply this in a number of domains. So this turns out to be rather useful and important in many medical problems. For instance, we're applying it to the problem, maybe it's a bit of a toy example, but quite interesting, the problem of estimating from disease data without information about genomics, how the virus was spreading from where to where. We're looking at things like treatment effects of policy interventions. We have quite a cool project, which you'll hear more about subsequently, about Simpson's paradox in case fatality rates, if you compare different countries. And we're starting to think about applying methods of causal emulations to complex simulations. So if you know of a very good overall simulation, please let us know, and we might be able to make a causal contribution to that. One other project that I wanted to mention is it's related to an app that's going to be published tomorrow. So this is about understanding disease progression and also identifying indicators, statistical indicators, but also causes that early on would hopefully let us predict severe clinical causes, because as we've seen, sometimes this disease can deteriorate quite, or the condition of patients can deteriorate quite rapidly without really us understanding what's the reason for that. So that requires more data, and trying to make a contribution also towards collecting this kind of data. One problem that I think is quite interesting from a theoretical point of view is the problem of testing. So there's this idea, which is probably an old idea, it's been around for a while, of multiplexing tests. So rather than testing each person individually, you throw samples together, test them jointly. You can do this in many different ways. This is related to fields like coding theory, error correcting coding. So you can sort of make a coding matrix, how you assign which sample you put into each bucket, and then you test the buckets, and then from the results of the buckets, you try to decode who has a positive test result and who doesn't, ideally in an error robust way. And we've been working with a number of people on this, and there's a rather cool little demo that a student at ETH has built. I invite you to play around with it a bit, where you use some clever optimization methods, you set the parameters, and then the system tells you how you should assign the different samples to the buckets and which tests you should be running. And one special case, which is of particular interest, is the estimation of epidemiological prevalence. So if you want to just get a sample of how many people in the population are infected, then it's somewhat wasteful to just run individual tests on a sample of individuals, because each individual test, at least the way it's currently going, the prevalence is quite low. So the most tests give you 0. So the test really doesn't give you a large information gain. So you would really like to increase the entropy of the test distribution. And one way to do this is to combine specimens and then run pooled tests. Now, tracing is also a big topic, and there's a number of different modalities, check-ins, contacts, space-time traces, with different limitations and strengths. So one topic that's discussed a lot currently are contacts, but I'm a little bit worried. I think we shouldn't put all our eggs into this basket, because I mean, there are these scary studies that show that sometimes these aerosols can stick around for a long time without evaporating, because they kind of shield each other. And so while as long as we don't really know, it would be good to stay open for different types of modalities. And in principle, motion data with GPS accuracy and above, because there are these additional tricks to get higher accuracy, are around. And I think we should really be asking that users should get the right to have access to their own past movement data, and then could pass on this data or give access to others that can analyze it. Of course, this comes with a lot of privacy concerns. So we're discussing in these kinds of topics also with other Max Planck Institutes that are into security, privacy, software technology. And you'll hear a more detailed model, point process model, in Manuel Gomez's presentation, which is the last part of this. I think I'm going to skip over this and just briefly say, end my part of the presentation with this small advertisement of this challenge that's coming up, and then hand over to Julius von Kügelgen.
All right, thanks, Bernhard. So I will briefly talk a little bit about joint work with Luigi Gresele, Bernhard, and also with thanks to Elias Borainboim. So we looked a little bit at how causality and in particular mediation analysis can be used to try to better understand the different drivers of COVID-19 mortality. And in particular, here we're looking at the role of age in comparing case fatality rates or CFRs using the example of China and Italy. And here you see these case fatality rates for different age groups on the left, and using the widely used large-scale study from China and the snapshot from Italy from the 9th of March. And so this is outdated by now, of course, but still we find an interesting phenomenon in this data, that is that for each age group separately, the case fatality rates in Italy are lower, but overall they are higher. And this is a prime example of what's known as the Simpson's paradox, which refers to the fact that the data can show different trends depending on whether we look at it by subgroups or in aggregation. And as you may have guessed, this can be explained by the different case demographic between these two countries shown here. So the proportion of cases involving older people is much higher in Italy than in China. Now, the reason this is referred to as a paradox is that these conditional probabilities shown in the figure on the left are usually interpreted by people in a causal way. And we then find it puzzling how the disease can at the same time be less deadly for the young, less deadly for the old, but more deadly for the people. However, to make such causal interpretations, we should start by making some causal assumptions first. And so here we assume the following causal graph shown on the left, where we assume the data is generated by first picking a country C, Then conditional on the country, we sample a positively tested patient with age group A. And then given C and A, we next sample the medical outcome or mortality M. Now, this is, of course, a very coarse-grained and simplified view at what we all know to be a more complex underlying phenomenon. And that's why these different arrows you see here subsume a lot of complex mechanisms, a couple of which are listed here at the bottom of the slide. As you can see, there's two directed paths going from country C to mortality, a direct one and an indirect one going through age. And we may be interested in trying to better understand how these two different path-specific effects combine to the total effect. And this is the field of mediation analysis. And so initially or naively, we might hope to find a simple decomposition where we can simply write the total causal effect as a sum of two terms, a direct and an indirect one. But unfortunately, this is not possible in general due to some interactions. But there are still some useful notions that we can look at. And here we're looking at two of those, namely the natural, direct, and indirect effects, shown in blue and orange. So the natural, direct, and these are shown in the graph on the bottom right for different points in time over the last month. Now, the natural direct effect in blue describes what would happen to the total CFR in China if the case demographic were kept the same, while the CFRs for each age group were changed to those in Italy. And we see that initially, actually, this would lead to a drop in the total CFR, which is consistent with our initial finding that for each age group, the CFR was lower in Italy. However, if we look at the blue trend line, we also see that around mid-March, there is a turning point where this direct effect flips signs. On the other hand, there's the natural indirect effect shown in orange. And this measures what would happen to the total CFR in China if the CFRs for each age group were kept the same, but just the case demographic, so the average age of patients, were changed to that in Italy. And as we see, this would lead to a quite substantial increase of around 3% in total CFR. And this effect seems to stay more or less stable over time. As a final remark, we can also see that the total causal effect over time grows more quickly than the sum of these two direct and indirect effects, indeed confirming that there is some interaction going on. So this is, of course, just the first step, and we hope that with more rich data becoming available, that we can apply these techniques also to more fine-grained versions and include other mediating variables other than just age. But this was more meant as an overview of how these tools can be used in the first place. And with that, I'll hand over to Manuel.
Hello, can you hear me?
Yes, works fine.
Yeah. Okay, before I start, I would like to acknowledge that this is a joint work with Lars and William and Stratis, that they are students at the EPFL-ETH and the Max Planck for Software Systems, together with Bernhard and with Aaron Sastov from Zero Base. And a lot of the credit should go for the students that in the last 3 weeks have kept on a pace that is quite intense. So as was mentioned before, no, contact tracing technology, what is that? No, is to this idea of using smartphones to track who you have met in the recent past. So that it happens that afterwards, if there is a person that is tested positive, if you have met this person, you will be notified, no? And other people that met this person will be also notified. So there are two different types of main technologies: location-based, that would be GPS, Wi-Fi triangulation, or QR codes, or there is also proximity-based technologies, no? That is more Bluetooth sensors in phones to track contacts. So a bit idea now is that the promise of these technologies is that if you do that, if you track the contacts, you will be able to predict the spread of COVID and a resolution, a spatiotemporal resolution that is like unprecedented. No, you will be able to know when and where new individuals' infections may happen, and also how likely these events may occur. And as a consequence of that, no, there is the hope that we will be able to actually design more effective strategies to slow down or prevent the spread of the disease. No, and in that way, we would be able to somehow lift some of the most restrictive measures that have been in place in many European countries or around the world generally. So, but for this to happen, no, we need to have machine learning models that are data-driven models, that they are designed to make use of this individual contact tracing data. And what is the problem out there that was already mentioned by Fabian earlier today is that most current models, they are used more to make country or state level predictions, and they don't really characterize the state of each individual over time. And here you can see two examples of a paper in Science and a preprint from arXiv from some colleagues in Germany, showing these kind of macro predictions. So here is where it comes our work. No? We work quite a lot in recent years in a temporal point process. So we realize, oh, we can actually design a model that use a marked temporal point process to jointly represent for each individual the epidemiological state. And here we don't reinvent the wheel, but we use a context-based temporal point process model of a traditional model that is called CIR. We also model the mobility patterns of each individual. Here you can think directly of the encounters with others, or for example, checking in sites if you have GPS locations. But at the same time, we don't only model the individuals. Here, one of the problems is that there is a lot of going on currently with health authorities and governments. There is a policy of testing and tracing. There is some policies of social distancing, business restrictions that are being deployed by different governments and authorities around the world. So this also the model, we actually incorporate and characterize this in a way that we can express different policies in a kind of meaningful manner. But maybe you are wondering, okay, how do we validate this model before actually there is a widespread deployment of these contact tracing apps? You can see in places like Singapore, China, they were, or in South Korea, they were used successfully, but in Europe, they are starting to ramp up. No? So to try to validate our model, what we did is a case study in Tübingen, Germany, where the Max Planck Institute for Intelligent Systems is. There, we actually had access to census data that is publicly available, also demographics about the age of the population in Tübingen, and also some high density maps from some initiative for Facebook for disaster response. So we actually combine this with OpenStreetMaps data, where we know the location of different type of establishments in the town, from bar and restaurants to supermarkets. No? And under some assumptions, we can create realistic mobility patterns, like for individuals, for each individual in Tübingen. So that we have these individual mobility patterns, combine it with case data, in this case from Robert Koch Institute, that is the authority in Germany, that gives the number of positive cases per day. And using Bayesian optimization, we are able to estimate the parameters of a model from these mobility patterns and this case data. So a bit the idea now is that here I can show you what the model can do. So what you see on the left in red is the actual COVID-19 case data of a version of Tübingen that is a bit downsampled for efficiency reasons. And what you see in black is actually our model fit. But here the important thing is that our model, we only fit it until the lockdown date. That was not an entire lockdown, but is when Germany started to deploy some measures. So until there is where we fit the parameters. From there on, the simulation is just simulating under some social distancing and business closures expressed in the language of our model. What you see on the right-hand side is the inference of the number of symptomatic, pre-symptomatic, asymptomatic cases in the same period as inferred by our model. So what we wonder as a first thing is what happens if these social distancing measures will not have been in place after lockdown. So we can just, in our model, just remove the social distancing and business closure kind of expressions, and shows up there how if they wouldn't be in place, would happen that in by today is not written there, but the model predicts that 1/3 of the population in Tübingen would have actually been infected. Moreover, to finish, I would like to also show you some plot that is pretty cool. That is, if from today, we would assume the current measures extend for a week, what would have happened, or if they extend for 2 weeks, 4 weeks, 8 weeks, we can model that. You can see there that if the measures are 1 week or 2 weeks, if afterwards they would be actually lifted, would happen, the epidemic still would continue. But if they are extended for a month, let's say, or 2 months, would happen that the epidemic wouldn't come back. There is a catch here that we don't take into account imported cases, but would be only local transmissions. So tomorrow we are super excited to actually release much more results in arXiv. And we also plan to release tomorrow or even today an open source implementation that a bit the idea is that we provide scripts to try to do the same analysis for other towns and cities, at least in Germany, or in places where there are positive case data available. And with this, I would like to conclude. Thank you.